Hi, good morning. My name is Ben Victorica, and today I'm creating a video on how the NSI platform is used on a copier to simplify clinical workflows. As you can see here in this illustration, AutoStore is a platform that allows for capturing paper from copiers and scanners and electronic files from desktop or mobile devices. They're sent to the AutoStore server behind your firewall in your environment, and then we route the metadata in the image or the document to your intended destination, whether it's an electronic health record, a document management system, a fax server, or whatever. We have a long history of doing this. We have over 30,000 installations. We have thousands of healthcare customers, ranging from the Department of Defense military hospitals to an ambulatory physician's office. The reason we're successful is the ease of use. The NSI platform, like I mentioned earlier, allows for scanning a paper document. You walk up to a device. Here you can see an illustration of a Ricoh device, and you pick your workflow with simple buttons to follow. You could do the same workflow from your desktop. Maybe route an email or an existing file that you have into the patient's record. And if you have a mobile device, a smartphone or a tablet, you can use the camera to capture a document or an image and send it also into the patient record. When it's sent through the AutoStore server, we're processing the file. We're doing document processing and image cleanup. We can transform the file into an HL7 document or maybe a text searchable PDF. We can read barcodes that are on the document. We can compress the file. We can transform the file, we can redact information, we can encrypt information, and then we're going to route the document. So we're going to route it to a document management system. We can route it to server-based document management systems, cloud-based document management systems. We can route it to database-based systems. We can route to SAP, Oracle. We can route out to fax servers. We support dozens of different brands. We can route out to email exchanges, and we can route out to line of business applications. In this case, and most importantly, it would be any electronic health record by sending the HL7 file as a payload. So I'm going to focus on the ease of use, the hospital communicator. The users would be able to securely scan, fax, release their print job, scan directly into an electronic health record. And at the bottom you see where it says user-centric security. It's based off of the authenticated user's permissions, allowing for this secure printing, scanning, and faxing, helping you reach high-tech omnibus regulations about patient privacy and security. And we're able to do this by providing you savings. So you're able to save your way to compliance. Hard cost savings, soft cost savings, potential cost savings. You can make it an operational expense and just add it to your copier monthly lease payment. And now it's an enterprise platform you can grow from, and it's easy to use. So let's focus in on the user experience. Easy buttons based on the authenticated user, and I'm going to show you some live examples now. So first, I'm going to authenticate as an admin so I have access to everything. I could use my card, or I can log in with the same information I would log in at my desk. So I log in here, and you can see that I can scan to patient, release my print job, securely send a fax, or maybe scan to a different destination. I'm going to show you three things: scan to patient, secure fax, and secure print. Let's do scan to patient first. With the EHR, I could scan directly into the EHR. Maybe the EHR is down for maintenance or something. I could create a new patient file and provide the hospital with business continuity. I can also scan with barcodes. Let's do a simple scan into an existing patient. We can hit the master patient index and bring back all the patient information so we don't have to stand at the copier and key information. We can do this by any type of variable data, last name, first name, or patient ID. I'm going to make it kind of a differential search. First, we're going to try to find Abby out of 500,000 patients, Abby Brock. We know her first name is spelled BR, so let's try that and hit search. Whoops, we found too many patients with that. Let's narrow the search and type in AB. And then we hit the search button. Well, we only have one patient, Abby Brock. So now we have validation right at the screen that we're scanning to the right patient. We can simply select the document type from a pick list that's defined by your administrator. Maybe we're doing a consent form. And we can associate it with a physician, Sue Jones. Now I put the paper in the feeder and I select the start button. The document gets scanned in and my work is done. There's a tremendous amount of flexible things that we can do here. This is just one example, and we make it both easy to use and highly scalable. Let's look at secure fax. Based on the authenticated user, we have fax destinations. We could fax outside the hospital. We could fax inside the hospital. Maybe you don't want to present any fax numbers and you can completely control where users can fax. Maybe it's just a button, they're faxing to pharmacy. They didn't have to key in any information. Again, this could be a database call. So first I can select my urgency level, and then I can select a patient ID. I'm going to type in 28540, which was the prompt here for this demo. And I do a database call and bring back that I'm sending a stat prescription to the pharmacy for Mildred Joyner. I simply put the paper in the feeder and hit submit. Very, very simple. I can do the same thing to do an outbound fax. I can control where the users can fax, and I can send faxes that may be only in a database. So maybe I type in a number. That fax number is not authorized. Or I could check frequent faxes, or I could do advanced searching. So again, it will control where the people are able to fax, help you prevent any kind of fines. And the last thing I wanted to show you was secure print. You can print something from your desk, walk up to a Ricoh copier, any Ricoh copier, and you can print those documents on demand. So you can select Print My Documents. For business continuity, you could print a form from a repository. So based on your user group, we could point it to different forms and you can print those on demand. Completely eliminate the reliance on pre-printed forms. If the application, the EHR, is sending print files for a clinician, we can store those files in the clinician's print queue. So again, they don't have to run to a printer to receive a file. It only prints when they're standing there. So these are some of the things that I wanted to show you related to AutoStore and how it works on a Ricoh device. I've shown you scan to patient, secure fax, and secure print. I want to show you one more thing. If I logged in as someone that didn't have access to patient files, I'm going to log out now. Let's say I'm the CIO and I want to log in. If I put in my credentials, you see here that I'm not presenting to the CIO, even the CIO, we're not presenting them the ability to scan patient files. That button has been completely removed. The users don't have access to that. So now you have two things, authentication and access control. Thank you very much for watching this video. We have many videos and other things that you can look at, but we look forward to really engaging with you in a discussion and answering any questions you have, so please contact us. Thank you.